This video will cover some of the more common spindled tumors of the kidney in adults. Buckle in, this one is going to be a stretch, but we're going to make it work and we'll be okay, I promise. To anger ourselves, well, we've got a spindle factory with 2 adults working. Let's talk about the first one. I hate the acronym for this one because my brain always has to realize that they're not talking about acute myeloid leukemia, AML. Angiomyolipoma is the first tumor we'll talk about, and it is represented by the fact that this factory recognizes this month to be AML Awareness Month. Next, let's take a look at the melon this worker has for his lunch break. That is, however, no ordinary melon. It's got an interesting pattern and pigmentation. This pigmented melon will represent the fact that angiomyolipoma stain with melanocytic markers. Melon sounds like melano, and the pigmented melon will remind us of melanoma. This worker is locked in, while the other one looks a bit more distracted. The worker that is locked in seems to have some beef with his co-worker's work ethic. He's even saying tisk tisk in his head. This represents the fact that angiomyolipomas are associated with TSC1 or TSC2 inactivation mutations. The fact that the worker is not actively saying this out loud will clue us into inactivation mutations, since if the mutations were activating, he'd probably be saying it out loud rather than keeping it to his own thoughts. And of course, these mutations are associated with tuberous sclerosis. Despite all this, the worker is still smiling, and this represents the behavior of angiomyolipomas, which are usually benign. Let's talk about his co-worker. Someone couldn't get this man a Kleenex, jeez. The snot on this worker, in addition to the fact that he works at a spindle factory and is currently working on a cylindrical piece of wood, will remind us that the next tumor we're going to talk about is mucinous tubular and spindle cell carcinoma. Let's move on to some diagnostics for it. You see how his lunch break snack is going to be a carrot? And not just any carrot, a carrot from heaven because it has a halo. Carrot represents keratin, and the fact that it is from heaven represents the number 7. So yes, this tumor stains positive with CK7. The next stain is Emacar, represented by this toy car next to him with a very familiar logo of the one very famous medical association. Put the name of this medical association together with car and you get Emacar, which stains positive. The next stain is represented by this Gandalf toy character standing behind a gate. What is Gandalf's most famous quote? "You shall not pass." Pass sounds like pax, right? And gate sounds like the number 8. There you go. This tumor stains with pax 8. Last thing about this tumor is that it is also usually benign, which makes sense because our worker looks happy. Let's move on to the third and last tumor. This one is called renomedullary interstitial cell tumor. Let's break it down. We've got a character here who isn't a worker. Who knows what they are doing here? Anyways, they've got this Medusa-type head and hair, and they brought their lunch snack too, a can of beans. Medusa sounds like medullary, and the can of beans represents renal. Notice how this character is also pretty short in stature, and again, isn't a worker and does not fit in this scene. You could even say the character is found incidentally in this scene. Together, these represent the fact that these tumors are usually incidental and small, less than 6 millimeters. Despite not quite fitting into the scene, at least this character brought something to the table. It brought a nice Nintendo star with it. The star represents the types of cells in these tumors, which are bland stellate cells.